Welcome, my alumni friends. My name's Jim Wright. I'm the Director of Alumni Services. And yes, I'm back for another week. As you know, the Recovery Made Real is really real, in addition to the fact that we are going to stay on topic, knowing that there's a tremendous amount of awareness for substance use disorder and mental health and other things like that. And it's so cool that we're able to come back on a week-to-week basis, and we'll post this broadcast on our Gateway Facebook page and our YouTube channel. So this week, it's mental health awareness. This is a very, very important part of our recovery, my recovery. And today we have a special guest from our Carbondale location, Tiffany Allen, who is our clinical supervisor there for our outpatient program. Welcome, Tiffany.
Thank you, Jim. I'm really happy to be here today. This is a subject that's really near and dear to my heart, and I'm glad that I can come out and share a little bit about it today. So there's so many risk factors out there that can become triggers for relapse and early recovery. Jim's asked me today to share my thoughts on how mental health, such as depression and anxiety, put somebody at a higher risk of relapse, and how to take care of yourself to minimize that risk. First, I wanted to share a little bit about myself. I'm actually in active recovery myself. I've been in recovery since 2003. After I went through treatment, I decided that I wanted to be a counselor, and I started working at Gateway. I got my master's degree, and I worked with the adolescent boys in the residential program for about the first 9 or 10 years of my career. And I've been over here with the outpatient program for the last 4 years now. Time flies. And I really love this job, and I've actually been able to hire some of my alums to come work for me here at Gateway as well. So, you know, there's a lot of future there and possibility. But getting back to the topic of mental health and recovery, I wanted to share a little numbers thing, right? The prevalence of mental health and substance use disorder occurring together in an individual. So what that means is looking at how they affect each other and what the connection there is. In my experience, more often than not, clients coming into programs at Gateway aren't only suffering from the effects of their substance use disorder, they're also suffering from several different mental health issues, whether it's something they've been diagnosed with in the past or something that they didn't even realize was a problem going into this. That's really common. We see it a lot. I knew I had problems with anxiety when I was going into treatment. I knew that anxiety was one of the things that drove my use. I had a lot of social anxiety. Thinking about sitting here doing a live Facebook event for me in the past would have been something that would have not have happened. My anxiety would have been so high, I wouldn't even be able to talk to you right now. I'd just be freaking out. So a little normalization. Thank you. Thank you. Studies have shown that about half of the people with a mental health disorder might also develop a substance use disorder. And that number works the other way too. Somebody with a substance use disorder, about half of them are very likely to develop a mental health disorder because of that. About 40% of the people with depression also have a substance use disorder. And about 45% of people suffering from anxiety also have a co-occurring substance use disorder. I always have trouble with that word co-occurring for some reason. It's hard for me to say. So people with anxiety it's a really common thing to self-medicate. Like I was saying, that was something that I did. It made me feel like I could go out there and actually talk to somebody I didn't know without having a complete anxiety attack.
Right.
So So looking at this, it's kind of a lot of people like to look at which comes first, the mental health or the substance use. What's causing what? Truthfully, it's kind of a moot point. It doesn't really matter. Sometimes the mental health causes the substance use disorder, sometimes the other way around, sometimes they just happen together. In some cases, what was I going to say here? So when we look at that and we're not paying attention to which came first, the chicken or the egg, right? The National Association of Addiction Medicine recommends first detoxification, right? Getting all the chemicals out of your body so that you can tell which symptoms are coming from what. Otherwise, it's hard to tell what's what. And then once you get all those chemicals out of your body, you want to treat both disorders at the same time. You want to treat the mental health and the substance use disorder at the same time, in the same setting, if at all possible. And that has the best possible outcome. And that's what we do here at Gateway. For those of you that have been, most of you have been through our Gateway programs, you know that we focus really strongly on both of those things. The critical piece of that is understanding how the conditions impact each other and what course of treatment is most likely to be effective for that person. And so then we develop the treatment plan and tailor it for that individual and update it along the way as necessary. So looking at, why do these occur together? What's going on here? And there are so many different hypotheses of why depression, anxiety, and other mental health disorders and substance use disorders happen together. One possibility is that they share common risk factors. For instance, certain genetic differences can influence the likelihood of developing both substance use disorders and mental illness. Other environmental factors, such as previous exposure to trauma or significant stress. None of us deal with stress, I'm sure. Absolutely. You have no stress, right, Jim?
Not today.
Not today.
Until we got on together, so you can.
Well,
no, but I was thinking, stress is the underlying stress, the from the COVID-19 pandemic, and I'll hush up here, but I think that's really, really important because there's so many underlying elements from the pandemic, the isolation, the potential relapse, other things like that. So I think it's a real big challenge, even pre-COVID or even today. I think people that I speak with are stressed.
Yeah. Well, and one thing to keep in mind, I'll use a real scientific term here. It's called epigenetic. It's kind of like genetics, but it's a little bit different.
Yeah.
So this exposure to trauma and stress not only affects the person that's having it, but it makes some genetic changes, not to our DNA, but to our other genetic parts of our body that pass down from generation to generation. So if you have family members that experience trauma and extreme stress in different situations, that actually can get passed down to you. So you're looking at hereditary trauma. Kind of an interesting concept there.
Yeah, I didn't even know that was possible.
Yeah, it's something I've learned about, and it's not something I had really thought about before, but it was really an interesting thing to think of. So that your great grandparents, stress that they had in another country when they came over here,
Right.
that kind of stuff passes to some extent through the generations and can be a risk factor. So one of the things, in treatment, you learned coping skills to help manage your co-occurring disorder, right?
Right.
And you possibly discovered medications that help in the process as well, whether it's medications for your mental health disorder or it's other medications to help with cravings and withdrawal management, right?
Right.
So the most important thing at this point, especially for all my alum out there, is that you continue to regularly focus on these skills that you've learned. Don't just put them aside. Keep using them. Keep practicing them even when you don't need them. And carry them on in your daily life to manage your specific symptoms on a regular basis. Because we all know that, both of these disorders are not curable. They're treatable, right? And they're manageable. And there's something that we have to be mindful and vigilant on. Mindfulness is one of my favorite words.
Well, that's a gateway. Every time I'm in a discharge group or working with alumni, they're always talking about how mindful they are about the tools they receive and the plan of action. So I think that is something, when people talk a little bit about daily meditation or just getting quiet. What do you, what is that what mindfulness means? Just getting quiet?
It can, yeah, that's a part of it, but there's also what they call mindfulness without meditation. And that is kind of that constant thing that you do. It's the opposite of autopilot. So autopilot is when, like, you've been driving somewhere and all of a sudden you realize you're there and you don't even remember how you got there, right? When you get up in the morning and you brush your teeth and you go and you eat breakfast and next thing you know, you're halfway through your day and you didn't know what was going on. That's autopilot. That's not being mindful. It's actually the opposite of mindful. But when you wolf down your dinner really quick and you didn't even taste it, we never have to do that with lunch here, do we?
Well, it is lunchtime there, right?
Yeah, it is. And so it's the opposite of mindfulness is autopilot. And so while mindfulness includes the meditations and the centering and that whole set of grounding skills that we use for anxiety and other disorders, it's really just being present in the moment right now, paying attention to everything that's going on around you, using all of your senses all of the time. Just broken down simply.
Right.
And so the process of being mindful is extremely important, both to mental health and to substance use disorder, because it keeps you from falling into those old habits that sneak back in there really quickly when you go into autopilot and can really derail your recovery in both areas quickly.
Right. What I was thinking, though, going back to where you said, because we obviously have a nursing program, we work with people on their cravings and temptations based on each individual's plan. I recall back in my own recovery, everybody said, quit self-medicating yourself. And I was like, well, what do you mean by self-medication? I said, well, when I was actually open and honest about it, I was like, I couldn't believe how many substances I used. When you're using that many substances, does that directly affect or make your mental health worse?
It may feel like in the short term, sometimes it makes you feel better, especially if you're using a lot of different substances and you've got kind of for lack of a better term, a designer group of what you use that make you feel the way you want to feel. I mean, we don't start using them because they make everything worse, right? That's not how we get into this. But what happens long term is that positive effect that you were noticing in the beginning, where maybe you're able to go out and party and socialize and be the life of the party, and so you're not feeling your anxiety and you're happy, there's no depression there. What happens down the road is these chemical changes start happening and it starts having an opposite effect. And then you start becoming more anxious, more depressed, maybe even developing some psychotic symptoms along with it. And then you get down into that hole where it starts making your mental health issues much, much worse than they were in the beginning.
Which then I think is with people in general, my relationship prior to me getting actually getting honest about my own addictions, I found that I didn't relate well with people without drinking or drugging in me. And I would make sure I'd have a private party before I'd go to the party. And and I remember the relapses. The first year I had a couple of relapses, and I would describe to either a friend that became a sponsor at 12-step type groups, in addition to therapists. And a therapist looked, she says, I don't think I've ever I've never really treated anybody that is multiply addicted as you. And then guess what we started to do? We started really looking at, once the substances were removed, it was amazing how I was able, even having a lot of anxiety, to be able to do that. So my question to you, you're a clinical supervisor, so you have a lot of counselors that work in this area. Have you ever felt that, I don't know, when people leave Carbondale and they bridge hopefully to our Alumni Services, have you had people come back because they, it just didn't work? Or, what's your thoughts on something like that when a client comes back, or they just need a correction or something?
Well, absolutely. It happens all the time. We have several clients that come through the program multiple times. What I want everybody out there to understand is that relapse does not mean failure. Relapse is very often a part of the process, and you got to keep that in mind. While you may do everything you can to avoid relapse of either your substance use disorder or your mental health symptoms, relapses happen. They can happen. They don't have to happen, but they can happen, and they often happen. And that doesn't mean you failed. Having a strong support system in place and having a plan of what you can do. I always tell people, plan for the unplannable, right? If you plan for the things that you can't plan for, right. I know that sounds crazy, but it allows you to have a backup in case nothing's working, and a safety person to call so that you can move on. A lot of people move on from relapse with a stronger commitment to avoiding future relapses by avoiding and managing triggers better. I mean, it's very common, even, for somebody to get much stronger and learn from a relapse of what not to do next time and how to do things different. And with that being said, it is really important to pay attention to your mental health in early substance use recovery as well. Because if you notice that you're having symptoms of your mental health disorder that have been showing, and you're not really doing anything about it, you're not taking care of yourself, you've maybe stopped taking your medicine because you ran out of your prescription and you were having trouble getting a refill or whatever, allowing your mental health symptoms to go on unmanaged puts you at about the highest risk level. It's actually the beginning stages of a relapse, not taking care of your mental health, not taking care of yourself well. It's an extremely integral part, and it reflects a lot of what's going on with you all together. So it's extremely important to keep your mental health in check in early recovery and on down the road in recovery too, because as soon as it starts to get the best of us again, it makes it much more difficult to stay away from any sort of substance.
So when we were diagnosed with your light went out.
It goes out all the time. It doesn't sense me moving.
What was interesting is that with substance use disorder, and we have a lot of other in 12-step, the language is there, but I find that it's very, very beneficial to understand the removal of substances. And like you said, relapse does happen. I found that I don't know about your own recovery, but I found that had to happen a couple times. I don't like to suggest that, but I was having some questions at our northern facility, and a guy came up and he looked at me and he says, "I've been in here 3 times. Am I going to do better this time?" I had, no idea, what his background was, but our counselor was in the room and she got to know him. And the fact was that he was like, "I'm ready." I loved what he said. I've gone through this whole process a few times, and now the substances are not appealing to me. In addition to the fact that we're talking mental health awareness, it was great to hear that. But that was 1 out of 17 people sharing that kind of thing. So, what do you, with the people that you've been, basically treating for, I guess this year of 2021? Do you see some significant increases in their in their recovery and what they want to do when they leave Carbondale?
Well, we see a lot. We use what is called the stages of change is kind of what we look at like that. And when so the stages of change are a circular process. It's non-linear, meaning you can go backwards and forwards in these stages. So people, when they're actively using, they're usually in what's called the pre-contemplation stage. And so what that means is that they're blissfully unaware. They have no idea that there's anything wrong with what they're doing, and they have no intentions of making any changes at that time. Usually something happens to kick them out of that stage. Maybe they get a DUI, maybe their family member said, I can't take this anymore. Maybe they got fired from a job. It could be any number of things. And then all of a sudden they question that and they're like, is there something wrong with what I'm doing? And so that's what we call the contemplation stage. Doesn't necessarily mean anybody's ready to make any changes at that point or that they are making any significant changes. It just means they've got a big question mark in their mind. Should I think about doing something differently than I am? And they may say, oh, hell no. I remember back when methamphetamines, believe it or not, was my drug of choice. And I remember thinking one day, my goodness, I didn't think in those terms. I'm going to have to actually go to rehab someday.
Well said. Well said.
Like that. Yeah, no, it wasn't in those terms, not back in that day. I said, I'm going to have to do rehab someday and get help to quit this. I don't think I'll be able to on my own. And then I remember the thought on the other side of my brain was like, not today, and right back into pre-contemplation. I slid, and so that process can go back and forth for a very short period of time or for a long period of time, depending on the person. And then once they've decided, okay, maybe I should do something different, maybe I have to do something different, then they move in what we call the preparation stage, where, again, they're not necessarily really making big changes in their life, but they're getting ready to, right? Maybe they've called the treatment center. Maybe they've set up an admission appointment to get some help. Maybe they've gone to their pastor or attended an AA meeting. They've done something to kind of lay the groundwork, kind of like if you're building a house, you put the foundation down to lay the groundwork for making some change. And then as they go through the process, they move into the action stage of change. That one kind of speaks for itself, right?
Right.
They're actually doing some things different. They're making some changes. And maybe they slide back down into that pre-contemplation stage for a while. They may have a relapse and they're like, oh, I messed it all up. And they slide back down there. And then there's the maintenance and the relapse phase. And the maintenance phase is where you maybe you go to meetings every week and you're staying engaged in the treatment and you're keeping your treatment going. And this works for both the mental health disorders and the substance use disorders. You could be in the action stage of change with your substance use disorder and maybe still not even believe that you've got a mental health disorder and be in the pre-contemplation stage for that and not ready to do anything about it. And so it's that circular nature and that human nature, I guess you can say, of sliding back and forth into those different stages that make it different for every person when they're going through treatment. Each person's treatment is very individual. Each person's set of symptoms, each person's recovery, it's all very individual. And you have to look at the specific person, all of their pieces, all of the factors in their life, and work with them on, where they're at. Each time they come back through treatment, I don't want anybody out there to think that there is any shame or judgment in having to go through treatment more than one time. When I see somebody come back through, well, in the last year, I haven't given them a hug, but usually I'll give them a big hug and say, but I am so glad you're back here so that we can get you back on track and get you to where you want to be. I'm always, very open and accepting, and we while we hate to see people back, we love to see people back. I hope that makes sense.
It does. Well, we're kind of coming toward the end of our session here. Tiffany, thank you so much. We typically, sometimes we get questions or comments, nothing on the screen at this point, but I wanted to just make sure that what Tiffany had shared today is so incredibly important to know, that stay connected. This is my, we have to stay connected. Not that we want to, but we have to stay connected in order to be part of the recovery. The Gateway Foundation alum app has become such a important part of our alumni. And when people definitely leave our locations, we want you to download this. We're in the process of a full relaunch, just some change of the colors and the icon and the name, but it's really, really starting to work. I enjoy it because there's so many things to go do. I love the post, and when people set up, they're either identifying them from a particular location or all alumni. I like the all alumni because we're able to see everybody that is using this. In addition to that, next week, we're gonna have a family panel, basically where addictions affect family. It's important to know that this happens, and I don't know if everybody develops a substance use disorder or has mental health challenges, but I think this is an important broadcast because we are going to have a couple come on next week at the same time. So again, Tiffany, thank you so much. Any closing words from you? Anything else you'd like to say before we go?
Well, thank you so much for having me. I've enjoyed this a lot. It was a lot of fun. And to all you alumni out there, keep keeping the faith, keep strong, and we're here if you need us. And have a good day.
Yeah, very good. And thank you so much for coming on again. And our anxiety levels are down now. So everybody, please have a wonderful, safe weekend, and we'll talk to you next Friday. Thank you.